When housewife Niharika Bhowmick from India was diagnosed with lung cancer in 2006, her prognosis was grim: 6 months to live. Niharika underwent radiation therapy for only 6 days when, due to failure to tolerate the radiation, her family discontinued traditional therapy. Niharika's son went to Dr. Prasad Banerjee, one of the eminent homeopathic doctors of Calcutta, whose work has been recognized by many top institutions around the world. Here, under Dr. Prasad Banerjee, Niharika began homeopathic treatment. Niharika made no real changes in diet or supplements. She just increased her food intake to improve strength, eating only the normal staple diet of rice, fish, chicken, mutton, lentils, and seasonal vegetables cooked according to Indian standards. She still eats sugar and also fruits. She has always lived to the theme of a poem of the Nobel Prize winner Rabindranath Tagore, which is, "Where the mind is without fear and the head is held high." Niharika claims that probably due to her age, she never felt any fear of death. 6 months to live, thriving 7 years later. The Thrive channel congratulates Niharika Bhowmick, ultimate survivor. I am a breast cancer survivor, a blood cancer survivor.
I'm Dr. Holly Lucille, a naturopathic doctor.
I am a mom of a teenager, basset hound owner, military wife.
My name is Dr. Deanna Atai, and I'm a breast surgeon.
I am a cancer survivor who is looking for answers just like you.
I'm Deborah Tripathi. I'm a medical oncologist.
What works, what doesn't? Welcome to Thrive with Namrata. My question is, although we have this story, we know that Niharika actually upped her intake. And the biggest question that I have as a cancer survivor is, when we see people with late-stage cancers, they're not eating that much. As a matter of fact, their body goes into a mode called, starting with a C, cachexia, that actually doesn't allow them to eat that much. So calorie restriction or not, what's the real deal here?
Well, there are some studies in mice that have shown that when you calorie restrict them, that their tumors are more responsive to standard therapies like chemotherapy, and they actually live longer. So that concept is actually being tested in the clinic right now. At USC, there are a couple of randomized studies going on to look at both side effects of chemotherapy as well as the effectiveness of chemotherapy in patients that starve for anywhere from 1 to 3 days. They've developed a kit that has a very low-calorie food you can eat that maintains the fasting metabolism. And it turns out that when one is fasting, the metabolism of the body does change, and it may change in a way that gives an advantage to the normal cells and not the tumor cells. So this is still premature. We still need to see what the clinical studies show. I can tell you from having been one of the investigators on the study that it is very hard on patients. They have a hard time fasting as needed for the study. So it's not easy to do, but we need more information before we can start doing it as part of standard of care.
Yeah, I think this is the way that we get the information, is by doing the clinical studies to make the leap that it works in mice. So patients should start voluntarily restricting their calories. That is probably not the way to do it. Let's do the investigating, let's get the data, because they could be potentially harming themselves more than helping.
Yeah, and I mean, I know that there's a lot of research being done in intermittent fasting. And I mean, caloric restriction is probably the #1 evidence-based anti-aging medicine that's out there, but you could see perhaps in our country why it hasn't swept the nation with folks just dying to get in there, because it is very difficult, and I think that we, but you know, as far as restricting calories, it's the quality of calories I still think that's important.
Yeah, absolutely.
Quality of calories. Absolutely. But then going back to the question with cachexia, so why is it, if there's any kind of merit to that, then why don't more people with advanced cancer have that kick in and essentially help the chemotherapy or whatever treatment they're doing help more, because now their caloric intake is a little bit lower?
Well, cachexia is a very late stage of cancer, and it is actually due to the elaboration of certain chemicals in the body that change the metabolism of your cells. So the studies that are being done now are not in people that are starting off in a malnutrition situation. That should be emphasized.
Great point. Thank you so much, doctors. We salute Niharika. Thank you for being an ultimate survivor and ultimate thriver. We'll see you next week.